And I said, come over, just come on over, you'll say.
Good morning, ladies and gentlemen, and welcome to the Town of Portland podcast. We're here at the Town Tech Educational Podcast Studio at Portland High School, and this is the, I think, year-end wrap-up for 2020. With me in the studio is our first Selectwoman, Miss Susan Bransfield, and on the phone calling in is we have our Director of Health from the Chatham Health District, Mr. Russel Melmed. So welcome all, and I'm your host, Dave Kuzminski, and let's get her done here. Susan, if you want to start it off, go ahead.
Sure. Yeah. Happy New Year's Eve to you today, and Happy New Year to all our listeners. We are definitely, Dave, looking forward to 2021.
Yes.
It's going to be a new year, hopefully a much better year. And in terms of health, I think it's very appropriate that we'll be talking with Russ Melmed this morning, as we do every other week. It's really been a good year in that perspective, but we're wishing people good health coming up in the new year. Just a couple things within the town. This week, we were not open to the public simply because it's been very difficult to staff our front desk. Many people take this time as their earned time off, so there hasn't been as much activity in the town hall. But I suspect next week, which will be January 4, we'll be able to have the door open and have staff ready to assist you at the door, and then to make sure that we're able to direct you to wherever you need to go to have your business conducted. I also want to point out that on Brownstone Avenue, you may recall the town purchased the brownfields that are down there at 222, 230, and 248 Brownstone Avenue. And I'm very pleased to report that we're starting the cleanup on number 248, and we are having Connecticut scrap metal out of North Franklin. For no cost to the town, they're coming in and removing the large above-ground blue tanks that have obscured. We can't see the river because they're there in front of us. So now they'll be down, I would suspect, within the next couple of weeks. And we look forward to some beautiful river views and the cleanup that will begin this next year, 2021, and putting that land back to the tax rolls, getting some buildings down there and some economic development. So that's just one of the many projects we'll be working on in 2021. So we'll look forward to that. And that's my short update for today, Dave.
Awesome. Well, I guess, with everything, the town hall is a little bit light. Everybody's taken their vacation time or burning up their personal time and so forth. So, it is, I think that's, I think throughout the industry, everybody kind of takes the holidays off and takes a little reprieve. So anyway, but that's great. Hopefully the 2021, as we ring this one in, and I think the consensus is making sure 2020 leaves. and
You got that right.
As far as that goes. So now we're going to get down to Mr. Russ Melmed from the Chatham Health District. And Russ, you've been, been on roller skates for the last 6 months and so forth. So give us the year-end wrap-up of where we are with the pandemic and where the district is and where our numbers are. So.
Sure. So we're not in a very good place with regards to the pandemic, locally. In fact, we're probably, from the numbers, from the way we measure it, in the worst place we've been over the course of the pandemic. I say the way we measure it because back in March and April, we didn't have the testing capacity to really let us know, to keep us as well informed as we could have been, as to how much COVID there was circulating. Some estimates say that there was roughly 10 times as much circulating in March and April compared to where we are now, but those are just estimates. But right now, from what we can tell, from how we measure it with testing, the entire state of Connecticut, that includes Portland, is seeing a lot of COVID transmission still. The reporting that we do for COVID-19 is about a week or two delayed from what's actually happening on the ground at the moment. And the reason I say that is because a number of things. One, there are delays from when somebody gets tested to when it gets reported and to when we generate reports. That's about a week. And the reports that we generate only take into account the 2-week period before the week of the reporting because of those delays. So we're trying to make our reports look complete and accurate, and the only way we do that is by sort of looking about a week or two back, because that will account for all those delays. But still, we're going to have another report coming out today that will include the week of Christmas. I expect to see our numbers remain flat or maybe slightly up, slightly down from where we are today, which is at 33 or 34 cases per 100,000 in the town of Portland. That's about average for the district. And I think that we're going to see not much of a change in the next report. This is just my expectation. Doesn't mean it's going to happen. I expect to not see much of a change because looking back at the week of Christmas, which is where these numbers will come from, there were a lot of people who weren't getting tested the week of Christmas. There were people who were either traveling or preparing for their hopefully small socially distanced festive meal and celebration with just their household. But I think there were a lot of people who were not necessarily getting tested. So I don't expect the numbers to look particularly dire. But next week's report I expect to reflect some of the transmission that we saw the week of Christmas. And so that's, again, not inevitable, but I just what I expect to see, that I expect to see a spike in the coming weeks of COVID-19 in the state of Connecticut. So even if we continue to see a flat curve, which would be great, which would mean a lot of people didn't get together with people outside of their household during Christmas, we still have a long ways to go to bring this curve down to where we were in the summer.
Sure.
And one way we're going to be able to do that, I think, is with vaccine. So
absolutely.
Thankfully, we now have not one but two vaccines that have attained emergency use authorization by the FDA, which is different from approval or licensing. So I want to make that clear. It's emergency use authorization, which is the same authorization that all the tests that we have right now fall under.
And soon to be 3, possibly.
Possibly, yes. On the horizon is a third vaccine. So that's all good news. The 2 vaccines that are out there, one manufactured by Pfizer and the other by Moderna, have roughly 94 and 95% efficacy in preventing disease.
That's a good thing.
So that's great. There's still some lingering questions that I'll just try to put out there right now for anybody listening. So 95% efficacy means that in clinical trials, when they gave it to people, gave it to 40,000 people, got the vaccine, and 40,000 people didn't get the vaccine, the rate of illness among the people who got the vaccine compared to the people who got placebo or a dummy vaccine, not the actual vaccine, the difference was 95%. So there was 95% fewer cases of illness among the group who got the vaccine, which is really tremendous. It beat all the expectations. I think we were hoping to see something 50% or better would have been good, but the fact that we got to 95%, I think, really lends some credence to the technology that was used to develop the vaccine. It's very encouraging news. What perhaps is still left unanswered is how long the immunity will last. We've only had the vaccines out even in clinical trial for about 4 or 5 months, so we don't know how long immunity will last. We hope it's a long time, but we just don't know because people have only actually been vaccinated and been living out there in the community for a few months in clinical trials, and for people getting the vaccine now, nobody's actually gotten 2 doses of vaccine yet.
Right.
So everybody's got to get 2 doses before they might consider themselves to be immune. We still have a long way to go, but I'm hopeful that now the vaccine is in the state. We have had some hiccups, I would say, in terms of the rollout, both in terms of vaccine that was manufactured and distributed to states, and also the ramp-up of vaccine clinics. And we are right now in a place where we don't have a lot of places that are offering the vaccine yet. There's some administrative challenges that everybody's going through right now with a federal system known as VAMS, Vaccine Administration Management System. It's a bear of a system that many of us, local health departments like Chatham Health District, didn't get a chance to even look at until about a week or two ago.
Oh, okay.
So it's a soup-to-nuts system that allows vaccine providers like Chatham Health District to order vaccine. It allows us to schedule clinics. It allows us to open up those clinics to people who make appointments. It allows employers to enroll and upload rosters of their staff who are eligible to get the vaccine. It sends automatic reminders to people who've gotten the vaccine to come back for their second appointment. So it really is a soup-to-nuts kind of system that, as you can imagine, for any brand new federal system that was designed, built, and rolled out in just the last few months, it's got some problems.
Sure. Like anything else.
Like anything else. I mean, anybody who works in IT, if we said, come up with a brand new system to do all those things and get it done in the next 4 months, would probably look at you and say, it's not possible. But,
yeah.
So there's some challenges, but I think we will get all those things figured out, and we will accelerate, hopefully, the number of vaccines we can provide to people right now.
Sure.
For people who are interested in getting the vaccine, right now, across the country and in the state of Connecticut, the vaccine is being prioritized for certain high-risk groups. The recommendations come from the CDC's Advisory Committee on Immunization Practices. They meet. Probably if you heard that there was some committee meeting to decide certain things, that was probably the committee. And then states take those recommendations and decide how best to implement or operationalize those recommendations. So right now in the state of Connecticut, under this phase of the prioritization rollout, again, because we have such limited amounts of vaccine, people are being prioritized based on their risk. There are a number of people who are eligible to get the vaccine, and those are healthcare providers, people who live in long-term care facilities, and another broad category that we'll just call first responders at risk for exposure to COVID-19. So those are police, fire, EMS, people who respond to medical 911 calls. And that's really it. So that's sort of in a nutshell. It does include, if you wonder who's a healthcare provider, doctors, nurses, allied healthcare providers seeing patients, pharmacists, pharmacy techs, school nurses would be included, dentists and dental hygienists and other oral health staff.
Right.
People who work in laboratories processing samples of potentially infectious materials like blood and other things.
Sure.
Students doing clinical rotations, death care workers, which, morticians and people who handle dead bodies.
Right.
So those are the people who are eligible under Phase 1A.
Right.
And it's a pretty long list.
Sure.
And I don't know how many of those people are in Connecticut, but probably a few 100,000 people in the state of Connecticut fall into those categories.
Right, right. Russ, on the, was there much of a spike after the Thanksgiving holiday attributable in the
Yes,
industry?
there was. Yeah, we did see a spike after Thanksgiving. And actually the report from last week in the state of Connecticut did show sort of, in the last 2 weeks, did show a spike. But now we've seen this flattening. So we did see a spike after Thanksgiving. I'm thankful it wasn't as substantial as I think it could have been. There were some other states that saw a more significant spike that we saw. Mm-hmm. It really was not as bad as I had expected. So let me just say it, not as bad as I had expected. Could have been others who didn't expect it to be very, very bad, but I expected it to be pretty substantial, and it didn't look that way to me. So that is good. And that gives me hope that we won't see a significant spike
after Christmas and New Year's.
After Christmas.
Right. Sure.
But I think, I heard plenty of conversations, again, just my own friends and family around Thanksgiving saying, well, we're not going to do Thanksgiving because we hope to be able to do Christmas.
Yeah, right.
Whatever that means to people.
Right, exactly.
Not doing Thanksgiving and we're going to do Christmas. So I hope that people looked at the numbers, saw that we weren't in a significantly better place after Thanksgiving and thought, well, it wasn't really a safe idea to get together with people outside my household on Thanksgiving. It's still that way for Christmas. But
right.
I just don't know. We just don't know.
Well, I think from a standpoint of, the 30,000-foot view, I think Connecticut in relation to, the rest of the nation is perhaps certainly in a better place than California as far as that goes. But
oh, yeah. I mean, there's some states that are really, really having a tough time. For whatever reason, Tennessee seems to be having a really tough time. There are a number of states. We're somewhere middle of the pack. There are states that have case rates that are in the 90s, and there are states that have case rates that are in the 20s and 30s, and we're somewhere in the area of 50 or 60 on a 7-day moving average. So, we're not doing as poorly as some other places. I'd say we're about average for the country.
Yeah. Which is, I guess, is a good thing.
I guess it's a good thing. But when you consider where we were, I don't want to, romanticize the summer, but I have a hard time not doing that. We were really in a great place over the summer, somewhere in the top 3 or the bottom 3 in terms of state case rates. So we really had a great summer, while some of our neighbors to the south in the Sun Belt were having a really, really tough time. And now it's a little bit the opposite. States to the north are having a tougher time than states across the Sun Belt. So
right.
And I don't know, maybe it has something to do with coming indoors when it gets cold up here. And maybe in the Sun Belt over the summer it had something to do with coming indoors as well. So
right.
It's really hot in Florida in July.
Right.
And a lot of people go inside to seek, air-conditioned environments. So
Sure.
I think that might have contributed to why you saw the spike across the south in the summer and why you're seeing a spike in the colder northern states more in the winter, while the southern states have a not as bad a time.
Right. Now, Russ, I mean, looking at the news and so forth, I think the UK has opted to give all of the vaccinations instead of doing a second one, trying to vaccinate as many people as possible. What's the method to the madness there?
So instead of doing a second one, I'm not sure what you mean exactly, but
I think the news said that they, instead of waiting and doing a second one, they wanted to get more people initially vaccinated rather than save the vaccine for the second dose for whatever number that they did in the first round.
So I don't know what their rationale is for doing that, and there may be a scientific basis for that, but it may just be an assumption that one dose will be better than no doses. But at least in the United States, we really look at what is authorized under the FDA's emergency use authorization and what is authorized and what is directed by those federal agencies and how to administer the vaccine is 2 doses.
Right.
2 doses is what provides you immunity. That's what the data shows, and if you're going to go off-label like that so soon after the release of the vaccine, I think there are very few people, very few state agencies that would be ready to take that leap and to just say, well, we'll get 1 dose into as many people as we can, and at some point we'll come back to everybody and give them a second dose.
Right.
I just don't think that we know enough. It's just me talking. I'm not the scientist to research the vaccines.
Sure.
I've not reviewed the data that the FDA panel reviewed on safety and efficacy, but if the science says that after 2 doses, either 21 or 28 days apart, depending on the vaccine, provides immunity, then I'm not going to make the assumption that, if we come back to people 6 months from now to give them the second dose, that it will get them to that 95%, immunity.
Sure.
I'm not ready to jump down that rabbit hole, but
right. I think that rightfully so. So, Susan, if the vaccine is available, are you willing to take that leap?
Absolutely, yes. I'll be right in line there, Dave. I'm getting a lot of questions, Russ, particularly from our community members who may be 75 or older. And they're, of course, anxiously waiting to get their turn for the vaccination. Any light you can give us in terms of how that will manifest itself? How is that vaccination going to occur?
So first I'll just say that no final decisions have been made about priority groups after this Phase 1A. There has been some talk that it will be older adults, either 75 and over or 65 and over, and then some other members of other critical workforce groups. But I'll set that aside for the moment and just say how will people get their vaccine? And at some point, vaccine providers, you'll be able to get the vaccine anywhere, from a pharmacy, just as you would a vaccine now. You'll be able to get it from your pharmacy, from your primary care doctor, from your local health department if they're doing vaccinations. It will become just like any other immunization that people get. So there should be a menu of choices for people to get the vaccine. If we end up in a place we're phase 1B, so we're in phase 1A of this prioritization rollout, which include the groups I mentioned before. If, for example, phase 1B starts at the beginning of February, because we've gotten all our healthcare providers and EMS service providers done already. And in phase 1B, the state of Connecticut has determined that people 75 years or older, or, for example, people with comorbidities like diabetes and heart disease, COPD, that put them at higher risk for bad outcomes from COVID-19 disease, if they're included in phase 1B, then the way that rolls out to people will look a little bit different. Then we might be talking about, because I don't know how many primary care providers will be up and running with providing vaccine at that point. There may be many, but there may not be many. And if there aren't many, then we will be having a conversation around the state about bringing what you might consider, classic public vaccination clinics out into communities where health departments or healthcare providers or both take over a large space, a school, a community room, a town hall if there's space, places like that, and start running public clinics for people who are eligible under that phase 1B. And no determinations have been made yet about who's going to be included in that second phase, but there are plans, and we at Chatham Health District have plans that we have been working on for many, many years now about how to run big public clinics. I think the challenge with the big public clinics are, with COVID-19 anyway, as opposed to with like a regular flu season, you don't want to bring a lot of people and crowd them together in a space. So I don't know if we would end up running gigantic high-throughput mass vaccination clinics or perhaps something a little bit smaller.
Yeah. I know that this VAMS, this VAMS system, that's something new to us. Do you anticipate that would continue? So in other words, all of the first responders and healthcare workers are in the VAMS system. Would the next priority, let's call it 1B, would also be in that VAM system? So in other words, you would have to be invited to participate?
Yes. Phase 1B, unless it includes the general population of older adults, which wouldn't be enrolled, for example, by an employer, right?
Right.
That would look very different. So let's assume for the moment that it's not. We're not talking about individuals living in the community that are older adults or otherwise vulnerable. But what the other groups that might be considered phase 1B are other school staff like teachers, critical workforce groups like public works, municipal employees, people who work in water and sewer, energy sector, manufacturing, food distribution, other critical workforce groups. If they're included, then yes, it would probably look very much like our phase 1A, where employer organizations are invited to enroll their employees, and they upload rosters of their employees because they know who their critical workers are. And then those people can go and get vaccinated anywhere in the state. So that's how the state has basically vetted whether or not a person is eligible under one of these priority groups, by going through employers. I don't know how that would work if phase 1B, for example, is just people who are 75 and over. Many of them are not going to be having their information uploaded by an employer. So,
well, I suppose there's Social Security. I mean, that's one aspect. I mean, I guess I'm not clear on whether this is a federal program, or is this as it's interpreted by the state of Connecticut and the state of California or the state of New York. I mean, how is this vaccination program being rolled out? Is it a federal directive or is it a state directive? I'm getting mixed messages in the media on this.
Yeah, you're getting mixed messages because it hasn't been particularly clear.
Oh, okay.
The VAMS is a federal system. I don't believe states are required to use it, but there are very strict reporting requirements for this vaccine because it is a federal asset, and there are some very specific requirements that come along with states taking possession of federal assets. Okay. The federal government has required reporting of vaccine administration, doses of vaccine that are administered within 24 hours of the administration of that vaccine.
Okay.
So VAMS, the system that we're all using in the state of Connecticut, was adopted by the state of Connecticut as the best way to get that done. The state of Connecticut was not interested in developing their own system, for example, for doing that. And so this is the system we have right now, and if it gets to that point where we're just vaccinating the general public, then people will probably be coming into a clinic and enrolling or entering their information into VAMS on site at some point,
Okay.
once we start vaccinating the general public. That's how I picture this going. Where
Well, I do know, Russ, because I talked to Chief Shea before we came on the podcast. We have some good news here in Portland, and that is several of our first responders, our public safety personnel, have been vaccinated. They were able to get appointments, and I'm happy to report about a dozen, about 18 have already received the vaccination. So that's good news, because we have the need for our police, our firefighters, our first responders to be able to take care of us and be able to respond with some semblance of knowing they have this vaccination. So, that's a good thing, and we want that to continue, definitely. And I know my niece is a nurse, and she told us actually it was a Facebook posting, she was also able to get vaccinated. So there is some good news here, and I know Connecticut is doing a good job. That's, again, what the public media is telling us, is that we are getting, percentage-wise, more people vaccinated than some of the other states, and I'm proud to see that.
Sure.
Yeah, we are getting people out there getting vaccinated. There are vaccine providers out there who are accepting appointments. Chatham Health District we expect to start running our first clinics next week. So
Great.
We'll be
Good
coming
news.
online just like other local health departments will be hopefully coming online. And I think as we ramp up, we'll see it become more and more accessible to everybody, not only people who are, getting enrolled through their employer, but at some point just anybody,
Right.
anybody who wants one at some point, hopefully will be able to get one. So I think,
Good.
seeing
Good.
people get the vaccine, I'm seeing a lot of social media posts of people, with pride showing a picture of them getting the shot. And,
Sure.
we've heard from a number of our in Chatham Health District, first responder organizations who their staff are eager to get the vaccine.
Yeah.
They're
Right.
eager to do it as soon as possible, as quickly as possible. And people are really, I'm seeing less hesitancy. So I think that's less hesitancy than I, had heard or dreaded leading up to this, which is great news. I mean,
It is.
Right.
this is how we will end the pandemic sooner, or
Sure.
bring us to some semblance of normalcy.
So have our health department, you and the other employees in Chatham Health District, have you been vaccinated yet?
No, we've not been vaccinated yet. We're going to do it at our first clinic. So once we open up our clinic, technically, to anybody, our staff who haven't been vaccinated will get it. But right now we've had, I think, 3 staff members who, as soon as they became eligible, scheduled appointments. This was even before we even had vaccine in our refrigerator. So we've got 2 staff getting vaccinated today, one in Manchester Hospital, and another, I think, at UCFS in Norwich.
Great. Very good. I
and for the
know
people-
Community Health Center in Middletown has been doing a lot of vaccinations within the various towns. They're doing really a great job for us, and I thank you for setting up that testing site we had in November, Russ. That was a great help to our community. We want to get more of that as well. If we can ask here on our podcast for another testing site, that worked out really well. Community Health Center is really out there doing the best and communicating well, and I want to thank Chatham Health District for arranging that here in Portland.
Do you want to do one on the 20th?
Sure, we will.
Okay.
Yep, sounds good
Let's
to me.
schedule it for the 20th.
Okay,
Same
For
time,
those of
same
you
place.
listening, we're penciling that in.
All
January
right.
20th. It's a Wednesday.
you heard it first
Uh,
here. Yeah, that's good.
Fantastic. Now, it's my understanding too, Russ, the governor, through executive order, lowered the threshold from 67 to 65. Is that correct?
Lowered the threshold for what?
For being the group to be vaccinated, I guess was the initial threshold 67 and above to be vaccinated as at risk, or?
So it's not formally been decided. I don't know if the governor made an announcement last night, but there has been, as far as I know, no formal decision made about who will be included in the next phase 1B.
Oh, okay. All right. So
I didn't listen to the governor's press conference last night. If he did say something like that, it is not reflected as of today on the state of Connecticut's phases website. So I'm not sure. But since you brought it up, if anybody wants to look it up for themselves, you can Google Connecticut Department of Public Health COVID-19 vaccine phases or CT-DPH COVID phases, and you will go to the page on the State Department of Public Health website that talks about who the priority groups are that are eligible as of today.
Okay. All right.
And if there are employers out there that have not been invited, that right now employ people who work in healthcare in any sense, that can be physical therapists, that could be mental health care providers, it could be, if you are in healthcare and you see patients, and you've not been invited by the Connecticut Department of Public Health to enroll in VAMS, you should Google Connecticut DPH VAMS employer enrollment. And that will take you to a page where you can request to the state of Connecticut access to VAMS for your employees. And then it will take a couple of days for them to vet you to make sure you are who you say you are, and you will be invited then to upload rosters. So the state did, I think, a good job sending out invitations, but, there are gaps. So for those of you who are thinking, well, I'm a self-employed, physical therapist. I go to people's homes to provide PT, and I haven't been invited. You can get access. You just have to request it.
Sure.
And that's CT-DPH VAMS employer enrollment. If you Google that, it'll take you to the page, and you can request access.
Awesome. Fantastic. All right, Russ, well, I appreciate all of the insight, and again, thanks for all your good work with you and the staff at Chatham Health. I think that about sums it up for 2020 from there. And like I say, hoping 2021 brings a whole lot brighter a future in putting this pandemic in our rearview mirror, to go from there. So be all set.
Yeah, great information, really. Thank you very much, Russ. And we'll get this out for our podcast listeners, and so they can learn a lot about this. It's very, very helpful. Thank you.
You're welcome, and I appreciate all the support from the town of Portland and helping us. It's all a big partnership, so it's been a tough year, but I think if there's good things that have come out of this year, it is, I think, all the good partnerships that have developed between the community and health departments and municipalities and police and fire, EMS, our healthcare providers. I think it's in a ways brought us closer together in ways that I didn't think a pandemic with social distancing requirements ever would.
Yeah, good point.
Absolutely. So, okay.
Very
All right.
good.
Russ, thank you so much. And again, you're listening to the Town of Portland podcast with our guests this morning, our first selectman, Ms. Susan Bransfield, and again, our Chatham Health Director, Mr. Russel Melmed. That concludes our episode to wrap up the 2020 pandemic year. I'm your host, Dave Kuzminski, and again, our podcasts are available wherever you listen to your podcasts, and they will be also post-produced and put on the Comcast Channel 15 access, public access channel. So from all of us here in the podcast studio, please stay home, stay safe, wash your hands, and above all, wear your mask, and Happy New Year. Thanks so much. Thank you for joining us today. I'm your host, Dave Kuzminski. Please tune in every week for new and relevant conversations about the town of Portland. You can find us at portlandct.org or at YouTube/Town of Portland, and now wherever you listen to your podcasts. If you've enjoyed our podcast, please consider subscribing and sharing with friends. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.